Now, continuing from here itself, let's go on to the intellectual deficiency because I wanted to show it to you before we start off with our class, right? So, what is intellectual deficiency? Now, as we have seen it in the previous diagram, before 100, whatever the the categories were, it's about the intellectual deficiency, right? So 90 to 110 is the normal distribution amongst the people. It's the normal IQ that people have. But in terms of intellectual deficiency, the American Association of Mental Deficiency views mental retardation as significantly sub-average general intellectual functioning existing co-currently with deficits in adaptive behavior and manifested during the development period. All right, so this is according to the AAMD, American Association of Mental Deficiency. All right, so this is shown in children with learning disabilities. These children show intellectual deficiency are termed as mentally challenged or mentally retarded people, right? So we have seen where people have termed them as mentally retarded or mentally challenged people. So it is because of these things. All right, so the American Association on Mental Deficiency, they have viewed, you have to please remember this, significantly sub-average general intellectual functioning existing co-currently with deficits in adaptive behavior and manifested during the development period. All right, I hope that is clear enough. Yes, so this definition points out on three features. Okay, so the first feature is, in order to be judged as mentally retarded, a person must show significantly sub-average intellectual functioning. Okay, so there are certain categories as to how the person has to be and how the person has to just pass certain criterias to be termed as mentally challenged or mentally retarded, whereas these days we don't term people like that. Okay, so the first is, in order to be judged as mentally challenged people, ठीक है, a person must show significantly, please underline this, significantly sub-average intellectual functioning. Intellectual functioning मतलब उनका एवरेज से भी कम में उनका इंटेलेक्चुअल फंक्शनिंग दिखना चाहिए, ठीक है? Persons having IQ below 70 are judged to have sub-average intelligence. All right, so significantly sub-average क्या होता है? 70 से भी कम, below 70. Okay, the second relates to the deficits in adaptive behavior. ठीक है, deficits matlab we can't do certain things, certain problems are there in us, so that we cannot adapt ourselves into the given environment. That is known as a deficits in adaptive behavior. Adaptive behavior refers to the person's capacity in independent and deal effectively with one's environment. Okay, so adaptive behavior is nothing but how well you adapt into the environment that you have. The third feature is the deficits must be observed during the development period, that is between 0 to 18 years old. All right, so the third feature is that the deficits must be observed during the developmental period. So first is that it has to be sub-average intelligence, okay, that is below the 70. Then there should be deficits in the adaptive behavior. And the third that we're talking about is about that these things and these criteria has to be observed during the developmental period. Developmental period is nothing but from 0 to 18 years of age. All right, all right. Yes. All right. So, I think we have talked about these three criterias that has to be judged. All right. So, individuals who are categorized as having mentally retardation, ठीक है, show significant variations in these abilities, ranging from those who can be taught to work, okay, and functions with the special attention. Okay. To those who cannot be trained and require institutional care throughout their lives, who have learned earlier than the mean. Yeah, we have already done this in the earlier class, right? So you have learned earlier that the mean IQ score in the population is 100. Okay, so these figures are used to understand the categories of mental retarded, the different levels of retardations. ठीक है, so जो भी 70% से कम है, 70 below 70%, significantly sub average, is known as mentally challenged. Okay, we will not say mentally retarded now. The different levels of retardation is one is mentally mild retardation. So retardation is different, but mentally retarded people is not something that we have to say it now. But retardation is itself is a category that we say. Okay, so mild retardation, that is from 69 to 55. So of course, imagine that normal curve, that first mean that we're saying, we are going from here. Okay, so 69 to 55. फिर आता है 54 to 40, which is moderate. So mild, moderate, severe, profound. Mild, underline that, moderate, severe, and profound. Okay, so 69 to 55, 54 to 40, 39 to 25, and below 25 is profound. ठीक है, so although the development of people with mild with mild retardation is typically slower that of their peers and can function quietly, the level of retardation uh, is typically slower. ठीक है, they can function quietly independently, okay, hold jobs and families. So ठीक है, they have their problems, they have their learning disabilities among especially their people who are their peers and their families, but still they can hold on to a job, they can be learned, and but of course extra attention needs to be given to them. All right, as the level of retardation increases, the difficulties are strongly marked. Okay, the people with moderate retardation, please remember that, increases. The difficulties are strongly marked. The people with moderate retardation lag behind. Okay, moderate retardation lag behind their peers in language एंड मोटर स्किल्स. ठीक है, जहां पे उनका मॉडरेट आता है, वी वर टॉकिंग अबाउट माइल्ड फर्स्ट, सो वेयर द मॉडरेट इज कमिंग देयर, द retardation is amongst lag behind with their peers in amongst language and motor skills. Okay, they can be trained in self care skills and simple social and communication skills. ठीक है, they need to have moderate degree of supervision and everyday classes. Okay, individuals with profound and severe retardation, incapable of managing their life. ठीक है, उनके लिए we need extra care and constant care about their we 1 second, sorry, so sorry, yeah. So constant care for the everyday lives. You will read more about this, of course, in the chapter 4 that we're going to do, which is about the mental disorders that all of us, we have seen it also. Okay, all right.